Hi guys, my name is Serene Samuel. I'm from DUE1B and this is our presentation of mental health problem. Hope you guys enjoy our video.
Assalamualaikum and a very good morning to Madam Darisna. My name is Fariza Mira binti Azili. My register number is 07DEE20F2043. Our oral presentation is mental health. As we know, mental health is not a joke and it's getting serious as a pandemic cause. Also, mental health problems do not count age. It happens to all people regardless of age, regardless, race, pro or rise. Mental health problems are very common on students such as SPM student, diploma, degree or many more. For example, SPM in 2040, 1 in 6 people in the past week experienced a common mental health problem, but anxiety and depression are the most common problems found among students. And with around 1 in 10 students affected at the one time, not just SPM students, but also kids of middle age or an old person. As we can see, this kind of sickness can be ignored because it's gonna land them to hurting themselves. Mental health problem range of worries we are experienced as part of everyday life serious long-term conditions. The majority of people who experience mental health problems can get over them and learn to live with them, especially if they get help early on. Mental health problems are usually different by classified to enable professionals to refer people for appropriate care and treatment. But some diagnoses are controversial and there is much corner in the mental health field that people are too often they rated equal to or disturbed by the label. This can have profound effect on the quality of life. Nevertheless, the diagnosis remains that most used way for driving and classify symptoms into the groups. Symptom necrotic counter symptom which can be regarded as serious form of normal emotional experience such as depression, anxiety or panic. Condition formerly referred to as nervous are now more regularly called common mental health problems. Psychotic, instead which a person perceives of reality and may be include hallucinations such as seeing, hearing, smiling or feeling that things no one else can. Mental health problems affect the way you think, feel and behave. There are problems that can be diagnosed by doctor, not personal weakness. What are the types of mental health disorders? Number 1. Attention Deficit Affective Disorders, ADHD. Attention Deficit Affective Disorder is characterized by inability to remain focused on task, impulsive behavior and excessive activity or an inability to sit still. Thus, this disorder is most commonly diagnosed in children. It can occur in adults as well. Number 2. Anxiety or panic diagnosis. Anxiety diagnosis is different by intermittent and repeated attack of instead fear of something bad happen or sense of impending doom. Number 3. Bipolar diagnosis. Bipolar diagnosis such a period cycling of emotional states between manic and depressive phase. Manic phase contains periods of extreme activity and high touch emotional where depressive peers are secretaries by lethargy and sickness. The cycles do not tend to counter instantly.
Hi guys, we meet again. Um, and now I'm going to replace my friend to present about what are the types of mental health disorder. Depression. Depression cover a wide range of conditions, typically defined by a persistent bad mood and lack of interest in pursuing daily life, as well as bout of lethargy and fatigue. Dystonia, I'm sorry if I didn't say it correctly, is a milder but longer lasting form of depression. The last one is schizophrenia. Schizophrenia is not, as commonly thought, solely about hearing voices or having multiple personalities. Instead, it is defined by a lack of ability to distinguish reality. Schizophrenia can cause paranoia and belief in elaborate conspiracy. Okay, next slide is short-term and long-term effect of mental health instability. In the short term, mental health problem can cause people to be alienated from their peers because of perceiving unattractive personality traits or behaviors. They can also cause anger, fear, sadness, and feeling of helplessness if the person does not know or understand what is happening. In the long term, mental health disorder can drive a person to commit suicide. According to the National Institute of Mental Health, over 19% of suicide have depression and another mental disorder as factors. Next slide is treatment mental health problem. Parents need to know the responsibility to their child. For example, ask them how the day going on, take them on the outdoor activity, or always be there if they have problem. Next is go to psychiatrist, a medical doctor who diagnoses and treats mental illnesses. The third is go to psychotherapists such as psychologist or a licensed counselor. The last is stay active. Exercise can help you manage symptoms of depression, stress, and anxiety. Physical activity can also counteract the effect of some psychiatric medication that may cause weight gain. Consider walking, swimming, gardening, or any form of physical activity that you can enjoy. Even light physical activity can make a difference into our life. Okay guys, thank you for listening to our presentation. Hope you guys enjoy it and see you in our next presentation. Bye.